COVID-19 outbreak, there were a lot of misconceptions, misinformation, and disinformation that ultimately led to COVID-19 vaccine hesitancy. Today, we are live at the dissemination event by Agency4All, themed Analysis of COVID-19 Vaccine Hesitancy, from data to action, drawing lessons from Nigeria's COVID-19 vaccination campaign. We will be interacting with CSOs and exploring the critical insights gained from Nigeria's COVID-19 vaccination campaign and how these findings can shape our future strategies in preparing for future pandemics. Today, we aim to draw valuable lessons that will guide us in enhancing vaccination programs and strengthening community engagement efforts as we foster collaboration and commitment among our esteemed stakeholders to transform risk communication and community engagement social behavioral programming in Nigeria.
I bring you, first of all, greetings from the United States Agency for International Development. I'm really pleased to join you all virtually today to join the Nigerian community of social and behavior change practice to reflect on the USAID funded Agency4All's work. We really look forward to drawing some insights from its in-depth analysis of data on COVID-19 vaccination perceptions. These surveys really elicit some important information about patterns and shifts in perceptions, attitudes, and actions of Nigerians related to the COVID-19 vaccination uptake. USAID used them to shape our critical policy changes and vaccine deployment strategies on the ground as we got those data coming out. However, this retrospective secondary analysis allows this community of practice to reflect on the significant drivers of vaccine uptake, the important factors in the decision pathways that lead to vaccine hesitancy or acceptance, as well as how these varied and shifted by sociodemographic characteristics or subpopulations. This is really critical as we begin to look on the horizon. Just now, as we're looking at the rollout of the HPV vaccines here in Nigeria, and potentially in the future, the rollout of the malaria vaccines, hopefully in the next year or two. They also allow us to enable us to apply this learning more broadly in our vaccination programs and prepare for future pandemics. In line with this event's theme of data to action, we urge everyone to use these data-driven insights as foundational principles for designing and advancing life course or integrated approaches to vaccination programs. Finally, I'll let everyone know that the Agency4All's activity is one of USAID's flagship global awards. The activity really seeks to generate new evidence on understanding agency, empowerment, and the individual's ability to convert intentions into action within and social behavioral change programs through locally led, equitable partnerships and innovative research. I appreciate all the effort and work that went into creating this data and this event. It is not only due to the valued partnership between the government, USAID's implementing partners and implementers that we can most effectively use this data. So thank you for the work that you do every day. And thank you for attending this session today. I look forward to seeing how you use this data to inform upcoming vaccine rollouts. Thanks.
My name is Rebecca Lundgren. I'm a professor at the Center on Gender Equity and Health at the University of California in San Diego. I'm here today as part of the consortium of Agency4All, a USAID project that works around the world to help promote people's intention into action. And here in Nigeria, we were working with our local partners to understand better the factors that promote COVID-19 vaccination. And as you could see in the name of our event, our focus is on moving data into action. And our purpose or our goal or our idea is that we move these findings. And some of the findings are things like the importance of understanding the groups that you're trying to communicate with, being very specific about, are they men, are they women, what state do they live, how old are they, and making sure that our communication meets their needs. And also working with partners here to collect information and use it along the way to improve all the work that we're doing in communicating about COVID-19 risk and the benefits of vaccination.
I'm very happy this research has taken place and the findings are disseminated. It's very good for the services to our community. So basically, this information that we have received, it will be very, very useful to members of our community, because you find that initially there was resistance. People were not ready to go for the COVID-19 vaccine and all other vaccinations, either as a result of lack of effective knowledge or information or awareness. The issue of the poverty level, people are not seeing it as a priority to change their health-seeking behavior, to improve their health status and the health status of the members of their family and the community. So with this information, at our own level, at the state level, at the local government level, and at the ward level, we have 62 wards in the FCT, and in each ward we have committees of the executive committees of the WDC. So this information will pass down, and then we'll meet our traditional rulers, we'll meet the community leaders, we'll oversight function to all the primary health care centers to ensure that they intensify information to members of the community and encourage, mobilize, and motivate them and come and get the COVID-19 vaccination and all other vaccinations.
Really great to have been here with at the Agency4All dissemination event. One of the data they used is the data from Breakthrough Action Nigeria, the telephone polling, where there were further secondary analysis of the content. And so one of the things that we're seeing is around the audience and how it can inform future vaccination programming like the HPV. One key thing we need to focus on is there's a need for continuous data in terms of that helps us to make informed decision, and we're able to look at that data to make informed decision. So when it comes to how can we leverage some of the findings, one of the key things that came out of this finding, and the focus was on COVID vaccination though, was male between the ages of 18 to 35 have not been vaccinated. That is a critical audience. So when you're looking at something like HPV, we need to make sure that the delivery channels for vaccine is relevant to the audience. So for HPV vaccine that is going to be targeted at school children, girls aged 9 to 14, that means school vaccination becomes a critical place where vaccine needs to happen. Just like we've left the men behind for the 18 to 35 age group, we need to find where are these men and then take the vaccines to them to make sure that we're able to close the gap. So overall, key things that came out of this finding is the fact that we need to segment our audience and use patient needs to decide where vaccines are, how vaccines are distributed, or where vaccines are, how vaccines can reach people.
The key takeaway really is that compliance is a very important factor, although this may differ between different segments of the population, but by and large, it is a very important factor. So moving forward, even as we think of other vaccines, like HPV, it is important to address compliance, but it is also important to address people's confidence in the safety of the vaccine and the competencies of the health workers who are delivering the vaccine.
For the health workers, you cannot discount capacity building. Before you can help anyone, you have to believe in that thing yourself. So the health workers themselves, their capacities have to be built. They have to be treated well. They're human beings. They're human beings and they matter. So what you're supposed to do to health workers, first of all, make them also believe in the value of those vaccines. It is only when they believe in the value of whatever it is you want to teach them, then they themselves can be of value to the general populace. They are very, very key. Without health care workers, what would have happened to us during the COVID-19 period? It would have been disastrous. But they came out, they supported us, even those who didn't believe in the vaccine. Over time, by the time their capacities were built, they now believed in the value of COVID-19 vaccination, and they themselves became the spokespeople for that vaccine.
This messaging has been going on for long. We did knowledge and awareness creation research at our end, and we followed what our citizens of FCT told us. As at now, the vaccination is better accepted by the populace of FCT. And in our communities, they are now well aware and taking the vaccination.